A substantive portion of treatment for overactive bladder is lifestyle modification. The treatment for overactive bladder starts with an evaluation method, and that is the bladder diary. Typically, you're recording when you urinate and measuring how much you urinate, writing that down, and rating each void against the degree of pre-urination urgency you were experiencing before you went to the toilet, usually on a scale of 1 to 10. The first thing you learn is how much is that patient drinking every day. And right away you can gauge, is this person dehydrated? Is this person in the habit of overhydrating, or is this more or less a good amount of fluid intake per 24 hours? If they're dehydrated or overhydrating, you need to start there. And then you can begin to look at how much bladder irritant beverages are they taking in every day. Some of the foods and drinks that are more irritating to patients with overactive bladder, they're coffee, tea, sodas that have a lot of caffeine in them, chocolate. For some patients sensitive to certain types of berries, particularly strawberries. There were a couple of studies that showed that just normalizing weight without any other therapy alone significantly reduced incontinence problems. One of the behavior modifications that's very common, that would be timed voiding and also strategic hydration. This is particularly helpful for patients where frequent nighttime voiding is a big problem. You want them to get to bed with a minimum amount of fluid still in their system and a minimum amount of bladder irritants coming into their system in the afternoon and early evening. There is some data showing that women can help restore continence and bladder control for all types of incontinence with Kegel exercises. The way Kegel exercises work for bladder control, the Kegel muscles contribute muscle fibers to the urethral sphincter that wrap around like a donut. So every time you're squeezing the muscles, you're also exercising the muscles in the sphincter. This can make the urinary sphincter stronger and better able to control urine flow, including preventing incontinence. This is crucial because overactive bladder is a chronic condition. It's not going to go away. It will always have to be managed. The earlier you come in for evaluation for overactive bladder symptoms, the better you are in terms of keeping your entire body healthy, and the better off you are in terms of getting a response to non-medical therapies like pelvic floor physical therapy and behavior modification without any medications.